then is it like a big challenge transforming from like just general surgery to now getting into it's laparoscopic?
Laparoscopic,
Because now we're talking about cameras being involved and high-end technology.
Yes.
Is it like a difficult bridge to get into?
Yes, I mean, as long as you don't know it, it's always difficult. But once you practice it, as you get experience, it's like everything. Like it doesn't become difficult later on. So initially, it is difficult because it demands a high learning curve. So you need to perform certain number of hours on the endotrainers. Then you spend some times in assisting senior surgeons. You gain more experience and then you become an independent surgeon. So it's a stepwise process. So initially you always find it difficult. And once you achieve all the steps, then I don't think it's any more difficult. But cost-wise also initially when you're a freshly passed out surgeon, these things may be a bit expensive. But over the long run, it pays off.
It's definitely worth it, right?
Yes.
And then if you're just to describe the surgery in layman's terms, because like, like even for my case personally, I was just afraid of surgery in general. And it's crazy because even for you said like your first surgery was appendix. And I actually also got like appendectomy, I think. Appendectomy, like, when I was like back in class 3 or class 4. But if you're just to describe it in a nutshell for people who are probably old school or are not used to like modern terms, like how would you describe it?
Surgery.
The laparoscopic surgery. Yes.
Now, see, the traditional surgery entails big cuts, opening up your tummy and then doing the surgery. So because of those big cuts, there is significant amount of pain after surgery. There is slower recovery. Someone may not be able to get out of bed very fast. But laparoscopic surgery in simple terminology are keyhole surgeries. So we make small holes which are size of a keyhole. Through those keyholes, we put cameras inside. We can see whatever is inside on a TV screen. Then other keyholes, we put some instruments, and under that the television guidance, we move our instruments inside your body and we can perform a surgery. So basically the cuts are very small, so pain is significantly less compared to the traditional surgeries. The chances of bleeding, infections are much less, and the recovery is much faster.
Okay, especially for the recovery bit, I think that's where a lot of people fear, because especially if you're an adult, you have other duties to perform, probably a job to go to.
True.
Like if you have kids and a wife, you still have to attend to them, so it actually makes perfect sense.
Yes.
Okay, and then like, what would you say like are just general misconceptions that people have about laparoscopic surgery?
Misconception wise, I would say they think that laparoscopy is way expensive. That's the most common misconception.
Definitely.
True. It's a little bit expensive than the traditional surgeries, but I would say it's not very expensive unless the higher end surgeries. But the most common surgeries like a hernia repair or an anti-reflux surgeries, gallbladder removal or appendicectomy, if you see the overall cost, usually laparoscopic surgery are more cost effective because you see once you go for an open surgery, you need to spend about 2 to 3 days in the hospital. So your hospital stay is longer. So that adds up on your bill. You stay from your work for significantly longer time. So that affects you in terms of your income. When you do a laparoscopic surgery, you may be discharged the same evening or maybe the next morning. So your hospital stay is shorter. So you cut down on your hospital stay, those medications. You can return to your work faster. So your income doesn't get compromised. So if you compare those things, eventually the laparoscopic surgeries are more cost effective.
You're getting your money's worth, if what to put it in that way, right? Okay, and then just... I know you've said like a typical timeline, but as long it's not that invasive, right?
Yeah, it's not invasive.
But what's the typical timeline? Like, would you say 1 week, 2-3 days before you're just like, I mean, I don't know again.
It always depends upon the surgery. Like simple surgeries like appendectomy, cholecystectomy, young patients like you, we may do the surgery in the morning, discharge you by the evening. Okay, some intermediate surgeries, you may need to stay 1 or 2 nights after the hospital, like bariatric surgeries, the weight loss surgeries.
Yeah.
Right now we prefer to keep you 2 nights in the hospital because patients are not very well convinced that I'm undergoing a major surgery and still have to go home very fast. But as we gain more experience, we tend to reduce it to 1 night and eventually as a daycare surgery. In Europe and America, the centers which have more experience, they are still discharging patients in the evening.
The same day?
Same day, even after those major surgeries.
Wow.
But we are yet to gain that experience to have high volumes here. But yeah, if you do a cancer surgery, maybe 3 or 4 nights after surgery, even after laparoscopy. But those surgeries, if you go for an open surgery, you may end up in hospital for 1 week to 2 weeks as well.
Okay. And is this determined by the technology that they're using, or just they are way advanced in like the hours they've performed the procedures?
There are multiple factors.
Okay.
It depends upon how much time you're spending in the operation theater. It also depends your age, your comorbidities. You should not be having any other diseases like lung issue, heart issue. So those factors also plays a part. How severe your disease is, like appendectomy. 98% of time it's a simple surgery. But the 2% cases when it's too difficult, infection is too much, you might have to spend 2-3 nights as well. So it's a multifactorial thing. But if you see majority, I would say about 95 to 98%, on average, it's very fast recovery.
Okay, this is just like maybe off my notes, but I also just want to get into a doctor's mind. Does it ever get normal, just like, opening up people and seeing like just body parts? And I'm just talking as a, because I was almost like, I was asking the nurses, like, is it too late for me to change my mind? But does it just get normal at some point for a doctor to just see like, different body parts and operating when you're seeing blood and everything? Because I haven't had like actually a surgeon on my podcast.
As in, I don't exactly get this question.
So does it get normal for you to just deal with blood? And just in general. Because that's and you see, even when I'm asking, just you don't even understand it, because it's like that's already like just second nature to you.
Yeah, kind of.
But
like
to
sometimes
us patients, it's completely different.
Yeah, for me, it's my day-to-day job. I see the blood every day. So now it's a routine for me, and I don't see any difference. Like it's subconsciously, I'll just go in and do the surgeries. But yeah, as a patient, it's something big for you. I mean, you never undergone a surgery. So your perspective is a lot different from my perspective. So sometimes it also happens, like a patient would feel that this doctor is taking it lightly, or he's not worried a lot. I mean, as a patient, it's first time for you. You're undergoing a cut. I'm not undergoing a cut. I'm the one putting a cut. But so that gives you a lot of anxiety, and you don't see any anxiety on my part. I am completely relaxed. So that also happens sometimes, that it's our second nature. We are used to it.
Okay, makes sense. And then like, how do you determine whether a patient is a suitable candidate for the laparoscopic surgery?
Almost always, all the patients can be suitable for laparoscopic surgery, except there are specific contraindications. Like when we want to do laparoscopy, we put a lot of gas in your tummy, like carbon dioxide. So if someone is having heart issue or lung issue, it may affect them. So if your cardiopulmonary reserve is compromised, you may not be able to undergo laparoscopic surgery. It also depends upon disease severity, like some cancers, if they have been too extensive, if they have spread to multiple organs, sometimes laparoscopy could be difficult. But otherwise, most of the patients, they are suitable candidate for laparoscopy as long as they don't have such contraindications.
Oh, like underlying conditions.
Conditions.
That makes sense. Okay, so now let's just touch on